Harmattan is a season with the typical characteristics of a dry and dusty season. The traditional Harmattan season leads to poor visibility for drivers, and while children and adults could suffer from cold, cough and catarrh, the season also leads to dry skin, cracked lips and sores of the feet. Bono East Regional Director of Health Services, Dr. Fred Adomako Boateng, admonishes the general public to be wary of the dry nature of the weather and embrace drinking more water, noting that it will help prevent common illnesses.
You quite remember earlier on when it was raining, people were saying that we are not feeling the weather. Now the weather has come, Harmattan has come. There are some things that we have to do. Look, one, we have to be well hydrated. And hydration, we talk about water. Weather kids, especially because when they are tasty, they will not be able to tell you. Make sure that we give them something to drink as much as possible, including us the adults. The moment you do that, what you actually do is that all the mucosal surfaces, the covering around your nose, your throat and your mouth is moist and watered. It doesn't lead to what we call break. There is no break in that, and there is no breach in that. Therefore, you don't have organisms that can cause the so-called what we call meningitis, because at this time people are at risk of having meningitis. So that if you are well hydrated, and then that mucosa, there is no breach, the likelihood of these organisms that can cause is not there. That is one thing that we also see.
He charged the general public to avoid overcrowding and urged people with cold to adhere to the use of nose masks and avoid going out.
Overcrowding, please avoid as much as possible overcrowding. Because if you're overcrowded in a space and it's not well ventilated, then it means that all the air is circulating and you are breathing the air that is supposed to go out. These are things that we will also have to do. Colleagues and friends, if you still have cold, don't go out. Don't go out to public places. And even if you go, we know what to do. Mask. It's very important that we do that.
Dr. Fred Adomako Boateng also charged the general public to adopt the various hand hygiene protocols which, according to him, help reduce various upper respiratory diseases.
But we can also see that people have stopped hand hygiene. Washing of our hands with running water and soap, and also the use of alcohol hand gel. These are what we call standard things that should be done. It's not because of COVID that we were doing them. In fact, COVID came to tell us the things that we are supposed to do. This is the time that we will have to also go back to them. Because if you go back to them, it's able to help us a lot. One thing that we realized during the COVID, that a lot of diarrhea diseases reduced. A lot of upper respiratory tract reduced. Because the way we touch our mouth, touch our eyes, touch our nose, unconsciously, we don't know. But if washing of our hands with soap and running water, and especially having alcohol gel close to you that you can easily use, then it's very important.
Anna Sabit, Choi News, Tichima.